The dissection in detail and examination of heart and coronary arteries. Pericardial sac is inspected for its content and any abnormality. Normally, the pericardial cavity contains 10 ml of fluid. If hemorrhage is suspected, its site of origin, ruptured ventricle or aorta, is determined, and the volume of any blood that is present is measured. Pericardial sac is opened by an anterior midline cut with a scissor. The coronary vessels are inspected for segmentation and the right side of the heart observed for its size. Palpated for crepitation as evidence of air embolism. Pericardium is cut over the diaphragm. Heart is held at the apex, lifted upward. It is isolated by cutting the vessels and entering leave it. Inferior and superior vena cava, pulmonary vessels, and ascending aorta as far as possible from its base. The isolated heart is then studied as regards its size and weight after sectioning. At this stage, it is important to note the amount of epicardial fat. The weight alone, without a comment on the epicardial fat, cannot make a borderline weight almost impossible to interpret. Ventricles should be separated and weighted. For accurate weight of each ventricle is required. The heart is frequently cut along the direction of the blood flow. Right atrium, right ventricle, pulmonary arteries, pulmonary veins, left atrium, left ventricle, and aorta. Right atrium is then cut between the opening of superior and inferior vena cava. One blade of scissor is passed through the inferior vena cava, and the right atrium is cut till the blade emerges out of the superior vena cava. An additional cut open the right auricle. The tricuspid opening is inspected. It should normally admit 3 fingers. The knife is then directed through the tricuspid valve to cut the right ventricle along its lateral border up to its apex. Incision is then carried along 1 cm lateral to ventricular septum on the right side, passes through the pulmonary valve at the junction of its anterior cusp and enter the pulmonary trunk and pulmonary artery. The left atrium is opened by cutting between the openings of the pulmonary veins. An additional cut opens of the left auricle. The mitral opening is inspected. It should normally admit 2 fingers. The knife is then directed through the mitral valve to cut the left ventricle along its lateral border up to its apex. Incision is then carried along 1 cm lateral to the ventricular septum on the left side, passes through the aortic ring in the region of the commissure between anterior and left posterior valve cusp and enters the aorta. If stenosis or incompetency of valves is an issue, diameter of the valve ring is measured. Auricular appendages are examined for thrombi, state of the myocardium, size of the heart chamber, state of endocardial, subendocardial hemorrhage in left ventricle in sudden hypotension. Example: shock, postpartum hemorrhage, ruptured viscous, and poisoning by arsenic oleander. Valvular lesion and condition of aorta as regard as any aneurysm, atherosclerosis or syphilitic aortitis, that is tree bark appearance, are described. The state of aorta is examined around orifices of coronary arteries. Heart can be studied after fixation by cutting in a series of rings not more than 5 mm thickness. This provides a good opportunity for overall study of state of valves, endocardium, myocardium, and coronary arteries. Sinus of valsalva are examined to detect congenital hypoplasia and obstruction of the coronary ostia. Examination is too often neglected. Coronary arteries, particularly the left coronary arteries, are examined by making serial incision down the course of vessel about 2 to 3 mm apart. To demonstrate any narrowing or anti-important thrombus, the common site being about 1 cm away from the origin of the left coronary artery. A longitudinal cut with the fine scissors provides a better measure of the extent of the atherosclerotic disease. If coronary artery disease is suspected, it is a sound practice to examine them before the heart is opened. Thank you.